If you don't already know the benefits of using social media as a health provider, it's important to consider how they can impact your practice. While these channels have so many benefits, they're only helpful if they're used correctly. The health industry is so sensitive between caring for patients and protecting their confidential information. Maintaining trust is key to getting people to visit your practice, but depending on how you conduct yourself on social media, it's possible to lose some of the trust from patients and staff. Unfortunately, not all health professionals follow appropriate behavior on these platforms, including while they are at work. But it's necessary to avoid these situations to set a good example for other staff and to get patients to trust you. Hi everyone, I'm Matt from eTactics, and today I'm going to share inappropriate uses of social media at a health facility. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. First, it's inappropriate to use social media in general while on the job in healthcare. It's likely that professionals will use their devices at some point during their shift. In hospitals, 78% of nurses use a personal device. 21% said that they used it for checking on or posting on social media. If you have a smart device, you know how difficult it is to put down. We have such a strong psychological connection to our phones that we imagine notification vibrations even if they don't vibrate. This makes it hard to focus when we just want to check our phones. But work isn't the time or place for it, especially when patients need constant attention. Unfortunately, social media causes distraction for healthcare workers. One survey found that an increase in social media correlates to more distractions and poorer job performance. 70% of respondents thought that access to these channels at work either currently is or would be a distraction for them. Nurse distractions and interruptions contribute up to half of medication errors. Because of this, it's best to avoid these platforms at work, at least until you're on your break. It makes it difficult to be attentive to patients and could result in medical mistakes. Next, it's inappropriate to take videos or pictures of patients. This sounds like a no-brainer, but health organizations still find that some employees post this content. If you work within healthcare, you're already familiar with HIPAA and the rules that come with it. One of these is that you need authorized consent for any pictures or videos, especially if you plan to post them. This consent is more detailed than just stepping into a room and asking if you can snap a picture for the company Facebook page. Even posting these to private groups or sending it to one person through a direct message is unacceptable. You never know who others will send it to once you send it to them. Or even worse, your account could get hacked and your messages could get leaked. This type of activity breaks privacy for patients, hurts hospital reputation, results in legal fines, and costs employees their jobs in some cases. Always receive proper authorized consent from patients before you even think about taking a picture or video with them, especially before you post it. Okay, maybe you already knew how bad it is to take photos and videos of patients without consent, but you also need to be careful about any subtle details that end up within the visual content that does have consent as well. Since you're surrounded by sensitive information, it's possible that a private document will end up in the background of something you share. Or even worse, a patient could be in the background themselves and they didn't give you consent to be there. Even though these are unintentional, it's still an appropriate use of social media. Any visual content containing PHI or patient identifiers can result in the violation of HIPAA. Because of this, it's best to avoid taking any pictures or videos altogether. And if you follow the first suggestion to stay off these platforms while at work, then this probably won't be an issue for you. Just because social media has positives in healthcare doesn't mean it's always beneficial. If employees don't use it correctly, it can cause more harm than good. Distractions from these channels only take attention away from patients. They'll lose trust if they notice you aren't completely focused on your job, and administration may lack confidence that you're a dedicated employee at their facility. Plus, using social media at work to take pictures or videos can cause HIPAA violations. This harms patients, the practice, and the employees who cause the violation, but if you avoid these platforms at work, you're less likely to create any problems for yourself. If you'd like to learn more about inappropriate use of social media in healthcare, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.